I've been in practice for more than 45 years, and last 25 to 30 years I've been doing clinical research, and found it to be very exciting. I participated in a lot of trials as a principal investigator, and all of these medicines have been approved by the FDA, and I actually are currently in the clinical practice. So I still continue to do it. My son has now joined me in doing clinical research. In fact, both my sons, even the ophthalmologist and the cardiologist, are excited about the clinical research, and we are expanding our reach, and most of the trials have been in cardiovascular medicine, but some in diabetes, hypertension, strokes, peripheral vascular disease, lipids, coronary disease, blood thinners, and found it to be quite exciting. It helps me to use some of the medicines in my practice, as I feel quite comfortable using these medications once I've been a principal investigator, because I get quite familiarized with the side effects and the dosages of these medications, and what kind of patients are most appropriate to use some of these medicines that have been released by the FDA. Most of our patients are coronary disease, peripheral arterial disease, stroke patients, hypertension, diabetes, and some of them related to shortness of breath. Quite a few are smokers. We deal with how to deal with getting off of tobacco abuse. Some of them are alcohol abuse. Atrial fibrillation is quite related to some of these. There are others that, like obstructive sleep apnea, obesity. All these are related to the cardiovascular diseases, and taking care of the underlying problem of diet, losing weight, exercise, although may not be directly related to cardiovascular, but indirectly it helps reduce cardiovascular events. And the idea is to really keep patients healthy. Sometimes it may even prolong lives in some of these patients. Are important in cardiovascular disease management. Over the last several years, clinical trials have helped release a lot of these medications, which helps to lower the cardiovascular events, heart attacks, strokes, blood pressure management, and it has actually helped improving the overall health of the nation and people all around the world. Some of these medicines have been released in poor countries too, and they're becoming quite affordable once again to generic medicine. As I said, this clinical research is important, but it helps more in my clinical practice. It helps me, puts me at ease about using some of these medications, which are recently released by FDA. Because being in the clinical practice, I know how these trials are conducted, and I can look at these studies of how carefully these trials have been and how many patients are involved, what's the p-value, or how many patients you have to treat to make the medicine more effective. So I've been doing it for 25 years, and I plan to continue to do it for the rest of my working years.